Welcome. Hello, everyone. On behalf of the Lung Health Foundation, I'd like to welcome you to our third and final policy forum in our Breathe Change series. My name is Jess Rogers. I'm the Vice President of Programs, Research, and Public Affairs at the Lung Health Foundation and your host for today's session. So before we begin today's program, the Lung Health Foundation would like to acknowledge its commitment to the recommendations of the Truth and Reconciliation Commission. We acknowledge that the Lung Health Foundation office in Toronto, Ontario, Canada, is located on the treaty lands and territory of the Mississauga of the Credit First Nation, as well as the traditional territory of the Huron-Wendat and the Haudenosaunee peoples. We acknowledge this land because it is important to remind ourselves that we are working on behalf of all Canadians, including Indigenous people who have been and continue to be negatively impacted by Canada's colonial history. It's impossible to have valuable conversations about lung health in Canada without connecting these conversations to the harms done to Indigenous communities. To this day, Indigenous peoples in Canada face health disparities and poor lung health outcomes. While we continue to learn, the Lung Health Foundation is committed to doing our part in reducing these health disparities and enhancing the healthcare system to meet the needs of Indigenous communities. Given today's topic specifically, we also want to acknowledge that for thousands of years, natural tobacco has been an integral part of Indigenous culture in many parts of Canada. Used in ritual, ceremony, and prayer, tobacco has been considered a sacred plant with immense healing and spiritual benefits. For these reasons, the tobacco plant should be treated with great respect. When tobacco is used in a non-traditional manner, it can cause severe damage to lungs and contribute to chronic lung conditions. In today's policy forum, when we're referencing nicotine and tobacco, we are referring to commercial tobacco products. We should also be very careful not to confuse traditional tobacco and its sacred uses with commercial tobacco and the addiction epidemic that we see today. So with that, thank you for listening. Why are we here? And what are we trying to achieve with our policy forums? So through forums like today's session, the Lung Health Foundation continues its leadership role as the voice for Canadians to ensure we all breathe easier. Policy forums are designed to tackle some of the most urgent and pressing issues facing Canadians, and youth vaping definitely counts among them. This policy forum and your input to the conversation is part of the Lung Health Foundation's larger effort to advocate for the changes necessary to support and protect Canada's youth from the harmful effects of vaping. We are not alone in this effort. Across Canada, there are many individuals and organizations that are tirelessly advocating as well. We really invite you to share those examples in the chat throughout the course of the forum to help raise more awareness around those efforts that are happening across Canada. The Lung Health Foundation is the secretariat for the National Lung Health Alliance, as an example. It's a current group of 10 lung health organizations from across the country that are committed to advocating for policy change, specifically youth vaping. You will find ways to get involved with this effort throughout today's session. Okay, so we want to get started with our programming. We first want to acknowledge our sponsors, without which we wouldn't be able to do these types of policy series. And so we do want to thank everyone for coming together to support the series that we've done on chronic obstructive pulmonary disease, lung cancer, and now youth vaping. With that, let's dig in and introduce our panelists. Throughout the session, please use the chat function. We have a number of our staff that are going to be in there engaging folks. You can engage with one another. Questions and answers, the Q&A section, please put your questions there. We'll do our best to get through them. What I will say is we take the chat and we take the questions post policy forum, and we do use that. That becomes part of our insight. So please take a moment to be commenting from your perspective. So I'm going to introduce all of our panelists, and then we're going to get kickstarted with Jeff. So Jeff Moko has worked in tobacco control as a health educator and youth engagement coordinator for the last 15 years. With Chatham-Kent Public Health. He is currently involved in a wide variety of prevention and cessation activities targeting youth and young adults. He is the current co-chair of the Youth Cessation Working Group, as guided by the Provincial Youth Nicotine Dependence Advisory Committee. Thanks, Jeff, for being here. Next up, we have Dr. Rob Shorts, who directs the research, evaluation, knowledge exchange, and capacity building programs. And he has published widely about tobacco control strategy, evaluation, accountability, public health policy, policy change and program evaluation in government. And so Rob's at the Ontario Tobacco Research Unit, as well as affiliation with the University of Toronto through the Dalla Lana School of Public Health. And after that, we have Chris Lamb, who is the president and CEO of the BC Lung Foundation, one of our National Lung Health Alliance partners. Chris is among one of the youngest leaders in the not-for-profit community. He really does work to push the envelope in innovation to help everyone breathe easier for British Columbia, but also across Canada and beyond, internationally, really. Chris is an experienced health advocate and fundraiser and leader who has spent 17 years evolving the tobacco and vaping cessation field in Vancouver. Thanks, Chris, for being here. And last but not least is our CEO at Lung Health Foundation, Jessica Buckley, who was appointed here in September 2022, who has an incredible entrepreneurial spirit, people-first leadership approach here at Lung Health Foundation to bring us to that next level in terms of driving innovation and effective positive change for people living with lung cancer. Jessica is focused on building lasting relationships across Canada with like-minded organizations, governments, healthcare professionals, researchers, and patients in order to fulfill our mission of improving the lung health for all Canadians. So welcome, Jessica. Thanks for being here. So we are going to hopefully activate people. We're hoping that we're going to inspire you so much that you're going to say, how can I get involved? What can I do? So there's ways, really easy ways to stay connected, which is join our network, follow us on social media. There are also going to be ways throughout the chat that will show you how you can become an advocate. Even sharing this session or sharing what you've learned among your community is a huge opportunity to raise awareness on this issue. And then you'll also see throughout, we have actual programs, free programs available for youth and young adults to support them in their quit attempts from vaping or smoking. Also in terms of supporting schools and parents around having conversations with youth around vaping. And we have lots of programs for people with chronic lung disease, like our virtual Fitness for Breath program and My Lung Health Coach. So lots of ways that you can engage with us, and we hope you do so. All right, so with that, I'm going to hand things over to Jeff, who is going to give us sort of ground level. Let's just really understand what's going on here with the vaping crisis in Canada. And so with that, Jeff, I'll invite you to come on camera, unmute yourself, and let's get started.
All right. Thank you very much. I'm happy to be here today. I've titled my presentation Vaping Reflections from Chatham-Kent. So I've thrown in a bunch of pictures of kind of our very wide and vast community, sitting smack dab in the middle of southwestern Ontario between London and Windsor. If you want to come down to visit, lots of water and lots of corn. You know, this is my 16th year working in tobacco control. Vaping has kind of swallowed up the last 5 for sure. And so today I'm just going to share you kind of the things that I've kind of picked up along the way, share some of the stories, trends, what people are using, how products are evolved. And because it's a policy forum, I'm going to end with, kind of find 5 major thoughts, to hopefully give you guys some, something to think about and maybe some action that you can take. More on the corn later. So how did I know vaping was an issue? I think it all started around 2019. I think it was Bill S5 that first permitted, nicotine products to be sold in Canada officially. And I think what really happened was we just got an explosion of calls for cessation, educational requests. There was 1 week where we gave out, I think, 7 fines for kids vaping in bathrooms. So I'm like, oh, we should do some education about this. And I remember writing a 400-word press release and sending it out. And the media inquiries I got for 48 hours just kind of blew me away, like live TV, morning radio show, evening radio. I'm just like, my goodness, so something really caught a nerve. And so I'm like, okay, there's something here. And the other thing, and this is an error on my part, was, dumb me, I put my work email address at the bottom of my press release. And I just got so much harassment from the vaping industry, operators and stores and things like that, who just was telling me all kinds of really not nice things. So I'm like, okay, so we got a really highly motivated industry trying to sell these things. And we have a lot of action on the street. And so that's where it's like, okay, we need to really do something about this. And so luckily for us, we were involved with our largest school board here. And we helped to kind of do, I think it was called the School Climate Assessment Survey. And what happened, we were fortunate enough to, ask about vaping. And some things that really stood out to us, and it wasn't really too surprising, because I think the one thing about Chatham-Kent is we tend to score higher than the provincial average on a lot of health metrics. And so vaping, definitely was for sure a thing. Um, for us, the 12% of grade 8 students reported vaping in the last month, but the 24% of grade 9 students. So that transition from elementary school to high school, by the time students were done, half of reported had been vaping ever in their lives, and this is much higher. And although this is self-reported data, I think what's important to note is that we have such a wide geographic region. The results were pretty much the same across all high schools. So, and all our complaints were coming, from everyone. So for us, it was like, okay, this is an issue across the board. And, if it's an issue here, I'm sure wherever you're sitting right now, there are also issues as well. This was like I don't know, it was like a cultural phenomenon, compared to all the other substances in society at the time. And this is, 2019. So, so this forced us to really highlight and put effort into prevention at the middle school age groups, grade 7, 8, 10 to 13-year-olds. I think we did a lot of prevention programming. And for high school, it's like, well, how do we offer support, cessation, and really do a lot of those protection and policy work? And so what happened was I met with a lot of students. It seems like I have regular office hours in most high schools in my community. And so I would have brief interventions with people. And my favorite question was, tell me what you like about vaping. They would never expect this, because as a health worker, most people were like, oh, he's going to tell me not to vape, and that's wrong for me. It's going to hurt my health. And what about your lungs? But no, I was very open-ended. I wanted to learn about the behavior. I wanted to get insight. Asking questions like this really lets you tease apart the why. And here is what I heard over and over and over again. Social pressure is a real thing. For people who get their first job that now has break times, a lot of people started at break time, in a work environment. Um, if you had an older sibling or cousin or neighbor, or your parents were trying vaping, you were curious, you did it, you tried it as well. There's a good percentage of people really liked how it made them feel. They liked the head buzz, they liked the flavors, but overwhelmingly, I heard over and over and over again, was I was going through some stuff, and I need, this helped me to cope. For many people, it was like vaping was helping them in some way. And and for all of you that work with people with vaping, I'm sure you can kind of agree with me that these are kind of the main themes. And it's not too surprising. I think when you work in other substances, I was going through some stuff, is sometimes what people talk about, with alcohol, etc. So that was kind of the why. um and I'm just trying to advance here now. There we go. So 2 days ago, I was arranging this on my desk at work. And all my coworkers walk by and they're like, Jeff, what are you doing? And I'm like, oh, I'm acting as a vaping historian today. And so what you see in front of you is an array of vaping devices that have been confiscated from students in our community, over the past 5 years. So you actually have a real life timeline of what people were using when. So let me kind of go through, and this will help you kind of understand some of the major trends in kind of the vaping world if you haven't really been paying attention. Um, so in points 1 and 2, this is pre-night 2019, when vaping nicotine products were not officially allowed to be sold in Canada. They were sold anyway. They just didn't say what was in them, which seems really sketchy and probably not a good practice. And so you see these really big, bulky, heavy items that had to be refilled. Very, very expensive. If you were vaping prior to 2019, you had to put a lot of money into it. The one device on the far left had actually a sticker on the box with the price tag. That's $179. There's not many 14-year-olds that are going to spend $179 to experiment with vaping at that price point. It's just they're not in that market. And so these things existed, but it was really at point 3 when Juul came on the kind of exploded in the U.S. It was a cultural phenomenon. It was on TV. Celebrities were using it. It's the smallest device on the screen. It really took the pod-based system, really made vaping explode. It just it was a phenomenon. But if Juul's are here in Canada, it was in stores here. We got some of these. But I think the Stealth product was kind of, maybe because it was popular here because it's made in London, Ontario, but they were way cheaper than Juul's. I think a three pack and a new device was something like between $15 and $17. And the other thing about these is that the concentrations were actually much, much higher. Their lowest, I believe, was 25 milligrams per milliliter. The one there in the green package is 50, and I believe they even had 60 and 75 milligrams per milliliter. So the if you're using this regularly, the dependence and the addiction potential was much, much greater. And then right to the left of the green package, you'll see a Breeze device, and that really changed the game in my opinion. Um, it's a larger device, more puffs. I think this one was a 600 or 800 puff. It's rechargeable. You use it and then you throw it away and get another one, for about under $20. And so you get more puffs for less money. It was quite remarkable. And that device, funny or not, like my best story that I have is that device was actually found in my front bushes. So I live near one of our biggest high schools in town, and I was doing yard work last year, and literally found, the one vaping education guy in his community found, discarded vaping device in his bushes. So I thought that was pretty funny. So that's kind of sitting there in the middle of the screen for you. And as you move right, you can kind of see that I want to say about 50 to 60% of the clients right now um, really use kind of the disposable model. It lasts longer, it's cheaper. And as you go to the right, we're in the middle of what I call a puff war. Now that the concentrations are limited to 20 milligrams per milliliter, what you're seeing is larger and larger devices with more advertised puffs. Because if you have a bigger container, you're going to have more liquid, and if you use more of that, we chances of dependence are greater. So that's something that I'm kind of concerned about at the moment, and we'll talk more about that in a second. But this school year, so if you look at point five, those are actually two cannabis vape products. This has been the first school year that I've had to go and respond to cannabis vaping. When cannabis was first, as of our as of our issues weren't hard enough, right? Cannabis legalization, a lot of the OCS branded items are very, very expensive, 50, 60, sometimes $70. They call this type of cannabis liquid gold. It's so expensive. Um, but we have access to some indigenous vape stores in our community who sell a lot of these products at a very, very reasonable price point. And then what happens is it's starting to become more frequent. So there's some concerns about, when young people are sharing vaping products, is this nicotine? Is this cannabis? For them who are very inexperienced, it's really hard to tell. So that's kind of what I've been seeing. Um, just gonna move ahead here. Got a little bit of a delay. Sorry about that. Here we go. So I know this is a health forum, but I'm not going to talk about health yet. What has the impact of vaping been in my experience? And initially, it's not health; it's behavior. Um, we really see when people come to me for assistance or help, it's usually as a result of a disruption in daily functioning, and that's kind of true of all addictions. But this is really kind of stands out to me. It's the irritability, it's the mood swings, it's the fighting with the parents. It's kind of money-seeking behavior, and from the education world, it's like poor school achievement, increased absences. Our separate school board shared with me recently that the number one reason why they have suspensions in their school at the moment is due to vaping. So it's really a problem. And I just want to give a shout out to my notanexperiment.ca friends who I see on the line today. They have a really good mental health youth focus page on vaping. And so the QR code that is there, you can go visit that, or maybe we'll put it in the chat for you. Okay. So I said, behavior first, and health is kind of interesting because for many young people, like the health harms related to vaping, it's not something on their radar, right? Like they don't really think of it's like this far away abstract problem. and it's never an issue until it is. And so here's a little story I wanted to share. This young woman I met, I think it was October of her grade 9 year, and she was initially caught vaping in the school bathroom. And I met with her instead of her getting a fine, she could meet me. We had a little conversation about vaping, and she really liked it. She had no issues with it. Everything was fine. She was enjoying it. It was a social thing for her. No issues. I'm like, okay. If anything ever changes, like I say with every person I meet with, feel free to reach out. I'm here all the time. She's like, great, I will. Fast forward to the spring, and I should have shared that she was a former track star in grade 8. She won every race that she was ever in. In the springtime, she entered her first kind of pre-track, some pre-meet that she was supposed to do, and she did terribly. I think she finished second last, and so she asked for a meeting with me, and we met, and she basically shared that she failed 2 classes in first semester. And she is no longer fast as lightning, as she put it, but she's just like, I'm just plain old average. And it really, really bothered her, and it really upset her. And the thing that stood out to me was like, she goes, I running used to be so easy, and now it feels like I can't even catch my breath. And to me, that really spoke to me. And she's like, I knew right away it was because I was vaping. I started in the summertime. I got my first job working in the corn, and it just, all the kids were older, and I was just trying to fit in, and it kind of stayed with me. And she actually was, she was such a strong person and she was so determined. She threw her device away, and basically, we worked to kind of replace her cravings with physical activity. She went really hard in her physical activity. Because she failed a couple classes, she actually had to go to summer school that summer, so the social environment changed, and it wasn't kind of around, she wasn't around vaping, and that's kind of what she needed to kind of undo it. But I think the thing that she told me was like, it's like, I feel like I've missed a year of my life and I wasn't at my best. And I think we want our young people to be at their best as much as possible. Life is hard. Let's help them be at their best. So um, to summarize, and I'm almost done, I have 5 main thoughts. It's a policy forum, so let's tease out some of the major policies that I think are important. There's many, many more. Um, so 20 milligrams per milliliter nicotine concentration. Since this came into play, um, I feel like I see less dependence initially, especially in younger audiences. It kind of creates an equal playing field. Um, One of the problems I see though is sometimes when we're helping people cut back, and some of the advice is, oh, transition to a lower dose product to help you kind of wean yourself up. There doesn't seem to be a lot of those kind of available in stores. So I think that's kind of an issue. Again, I said about other jurisdictions, you can get higher ones around here, but potentially you can get some online. Should it be lower than 20 in Canada? I don't know. I'd like to debate that with some people. I'd like to hear some arguments. Number two, the industry is very influential. The top selling brands are whole or partly owned by tobacco companies. Their lobbying power is so much greater than what we are able to do. And any mistakes we make on policy can be costly. This image here was from 2018. And, we had a good 6 months where vaping products were advertised like crazy in Ontario. Every gas pump you could, I counted 8 signs on one pump one time. And, to this day, I still think, what did that period of time do to the vaping problem that we have today? And so, Chris, when he talks later, he's going to talk about, taking bold steps. I really believe that's something that needs to be discussed. Number three, device design, packaging, and labeling. I already talked about the kind of the weird, is this cannabis or is this not? We need to have some steady labeling. We can't let them make claims like feels like 50 Nick. Like, what does that even mean? The concentration is the concentration. We can't add some we can't add some fluff to it. And the puff wars, I think, are a problem. If I came to your house tonight to watch the baseball game and I brought a Costco jumbo bag of chips, and we open it up, human behavior says the whole bag will be eaten. And I think it comes with vaping products too. The larger container, the more on demand it is, the more we're going to use, and I think that kind of creates more dependence. So I'd like to know more about that. Number four, I know, Jeff, why is Taylor Swift on your screen? Well, specialty vape stores is why. We had two stores forever. And then within just over a 12-month period, we now have 22 specialty vape stores in our one small community. Um, and many of them are within visual or walking distance to every single high school in our town. And that to me, I think is an issue. Initially, the push behind specialty vape stores in Ontario was we're gonna take out flavors and we're gonna put them in a more regulated environment. We're gonna get them outside of every gas station and convenience store. So what happened? Every gas station and convenience store erected a wall in their store, and the back door is now the front door of a vape store. And it just seems really strange. And so I think there's a lot of really weird regulatory issues, and these stores are making a lot of money. So something to think about. And finally, in closure, I'd like to inspire you to take some time to update whatever tobacco policies that you have ownership or control or influence in to now include nicotine and vaping. So last month, I approached our minor baseball association. Luckily, I'm also a volunteer there, so that kind of helped a little bit. And I said, hey, can we adapt your tobacco policy to include vaping and nicotine products? They're like, sure. And so we did. And so starting May 1st, which is literally over just 2 weeks away, um, no nicotine, no synthetic nicotine, or any associated nicotine products are able to be used on all fields, practices, games, activities, events for participants, officials, coaches, and observers. And they really want to acknowledge the role that they have in promoting healthy living and being role models to youth in our community. And I thought that was fantastic. And I really hope that that inspires you to get out there and kind of do this stuff too. So I just want to thank you, along with Fergie Jenkins here from Chatham, Kent, for your time today. If you ever want to reach out to talk about any of the stuff I shared today, please do so. I'd love to hear from you. Thank you.
Thanks, Jeff. Before you go off camera, Jeff, I just really appreciate that you're able to give a concrete example of something that just each of us as individuals can do in our own communities, something as simple as changing an existing policy, for example. I think that that's really important to help inspire everyone on the call. Just two quick questions, just from a clarification that came through the chat.
Yep,
So I think just given that not everyone understands the concentration level, can you do it sort of as just a quick example of like sort of the equivalent of how many cigarettes that might be in terms of some of the concentration levels, or a way for people to understand,
for
that
sure.
just be 20 mils, 50 mils, et cetera?
Yes. So, I generally speaking, I think what I've always learned is about 14 puffs at 20 milligrams per milliliter is approximately one cigarette worth of nicotine. So in the one image I showed where there's 5,000 puffs, that's actually 360 cigarettes worth of nicotine. Now, I think vaping, there's some biochemical stuff going on where some is, passed through urine and not of it, some formulations are better absorbed by others. But I think over time, things are able to mimic, burning of tobacco in terms of nicotine absorption. And so 20 milligrams per milliliter, I think, is like a Health Canada guideline. And so most products being sold are at that top level. Very few are at the bottom level. Is
Thanks,
that
Jeff.
pretty clear?
Yeah, for sure. I think because we've got such a good mix of people on the call, it's helpful for people to appreciate, okay, so what is it that we're talking about there? And then just one last question before we hand things over to Rob Schwartz. So just a quick question around difference between specialty vape store, regular vape store. You sort of said both. I don't know if there is a difference necessarily, but just for people
Um,
to
it's
get their
it's
head
like
around.
it's a classification of the Smoke Free Ontario Act, so
Right.
it's a relatively new thing. The idea was that there was too many flavors, so I think a regular gas station can only sell like tobacco flavor and maybe like none of the fruity or berry flavors can be sold type of thing. I need to know more. Usually our enforcement people are really strong about those things. But now as public health units, we have to regulate these environments, and so it's creating a lot of regulatory um, issues, because they're kind of popping up everywhere and without any kind of real oversight. So,
That's great. Thank you so much. And we're lots of great stuff happening in the chat. So let's hand things over to Rob Schwartz. Let's thank you again, Jeff. Jeff will be back. And Rob's going to bring us from sort of on the ground level. What's this looking like from the experience, and then how is that reflected in the research? What are we learning? What do we already know? And what are we kind of keeping our finger on the pulse of in terms of where we go from here, both in terms of the kind of clinical evidence around this, but also from a policy perspective of the different policy levers that we do have in Canada and have been tried. So with that, I will hand things over to Rob.
Thanks very much, Jeff. And it's a pleasure to follow Jeff Moko. I'm not able to control the screen, even though it says that I can. There we go. Okay. Jeff did a tremendous job of portraying the picture of what is happening on the ground in Chatham-Kent. And my job is to take those really good stories and the real life experience that Jeff has conveyed, and to sort of bring that up to a level of science and evidence and what do we know about what's happening across Canada. And so what's happening in Chatham-Kent is a really good microcosm of what's going on in Canada in general. I'm going to start by showing you some prevalence data, then I'm going to talk about health effects, and finally I'm going to talk about evidence around policy solutions to the problem at hand. Do we have a problem? We absolutely have a problem. This is some of the latest data that we have. Unfortunately, we don't have up-to-date data to 2023 or 24, but in 2021-22, this national data shows that in grades 7 to 12, like these are young people who shouldn't even be able to purchase e-cigarette products. Past 30-day use is up to somewhere between 15% for females and 19% for males. And past 30-day use isn't a perfect indicator, but it's a pretty good predictor. If you're using the past 30 days, that when we come back to you in a year from now, you'll be using a lot more frequently. So that's one set of data. And the next slide shows a bit of a trend. So when we started this business back in around 2016, which is before the legalization, we already had a past 30-day use prevalence rate of 8.7%. That went up to 19%, came down a little bit in 2021 to about 16%, and this is for ages 16 to 19. But then look at what I have placed at the bottom of this figure. This is the most recent CCHF data, and it shows that in 2022, 19.7%, so almost 20% of young adults aged 20 to 24 had past 30-day use, and that was up significantly, and I would say substantially, from 2021 when it was 17.2%. So what I think is actually happening is that those young people who start vaping when they're in high school become addicted, they can't stop, and they continue into their young adulthood when they go off to college or university or to their work situations. So yeah, do we have a problem? I would say we have quite a serious problem happening here. And as I try hard to advance the slide, now I'm going to talk about the health effects. So you might say, okay, so what? What's the big deal? If we have almost 20% or somewhere around 20% of young people past 30-day use, 1 in every 5, what's the big deal? What do we know about the health effects? And so I've taken, this is a slide from the American Centers for Disease Control, and it just shows you what's in the aerosol of these e-cigarettes. Well, quite a lot of stuff that you actually wouldn't want to have in your body. So I don't want to be alarmist. I want to really be scientific about this. It really is a question of how much of these substances are being absorbed into the systems in our body, especially the respiratory system. And we don't have perfect answers about that, but in the next slides, I'm going to show you a little bit about what we actually do know so far about the health effects. It's important when we think about the health effects to remember that we do not have perfect information. And I'm really sorry, the slides are very much delayed in progressing. Here we go. So what I want to warn you about is that we need to be very cautious in interpreting the evidence that we do have. it's important to remember the absence of evidence is not evidence of absence. So we don't know, like there's a lot of evidence that we don't yet have of the long-term health effects of using e-cigarettes. But that doesn't mean that there are no health effects. It just means that we don't know yet. We haven't accumulated that evidence. And so we have to be really careful about that. Another problem in measuring health effects is that an e-cigarette is not an e-cigarette. It's not an e-cigarette. Cigarettes are pretty much standardized, not completely, but pretty much standardized. E-cigarettes that Jeff showed you, come in different shapes and sizes and colors and nicotine concentrations and power configurations, and people puff on them in different ways. So it's really hard to say what do e-cigarettes in general cause? What health effects do they cause when people are using different things? And not only that, they're changing what they use. Right, so Jeff showed you over the course of 5 years the changes in things, and we have a longitudinal cohort of youth and young people who use e-cigarettes, and we see in what they report to us, they're changing their products quite frequently. So it's really difficult going to know, to tease out the effects of what any one kind of e-cigarette that they've used or e-cigarette liquid that they've used over the course of time. So that's a tough one. Thirdly, is the problem of, sorry, that jumped for me, the problem of exclusive vapors. So it still is the case that the majority of people who use e-cigarettes are dual users or are former smokers or current smokers. And so in teasing out the health effect, it's really hard to know which of the health effects are due to using e-cigarettes versus using combustible cigarettes. Okay, I think that's enough about the cautiousness of interpretation, but one thing to remember about that is we have to remember the precautionary principle, which says that we don't wait until we have perfect information before we take action. If we have sufficient evidence suggesting the likelihood of harms being greater than the benefits of using a new product, then we need to take action. And I believe that is the case now regarding e-cigarettes and their use by people who don't smoke cigarettes. So thinking about the health effects, I want to start with dependence, or call it addiction. And a lot of people don't think of this as a health effect, but remember that dependence is a diagnosis. It is a diagnosable disease. So we should consider dependence in of itself as something of concern. And Jeff has also alluded to that already. And so there's no question. Okay, the evidence is really quite firm on this. A recent review by Panks in Australia, and then we've just completed a systematic review of the health effects of using e-cigarettes called Vector. And our review also shows very, very clearly that not only are e-cigarettes causing dependence from the nicotine, but that they are even they cause dependence as much as cigarettes do. And so this is of great concern. So we've done quite a bit of research using our longitudinal cohorts, and you can see a couple of our publications listed here. And these are demonstrating very clearly that young people are becoming addicted over time when they use e-cigarettes. The more they use e-cigarettes, the more likely they are to become addicted. And the longer they use e-cigarettes, the more addicted they become. It does take, apparently, from the research that we and others have done so far, a bit longer to become dependent on e-cigarettes than it does to become dependent on combustible cigarettes. And so it is something that does take some time. And in our study, we found that almost 2/3 of never smoking young people have become addicted. amongst current vapors, and amongst those who are never smokers but are vapors, but have never smoked, about 80% report being addicted. So this is based on self-reports, but using validated scales of the measurements of addiction. And you can find that reports in nicotine and tobacco research from 2022. We also have demonstrated that it can take up to 2 years, and you can see in this slide very clearly that at 24 months, there's a long list of dependence-related occurrences, having strong cravings after working, strong urges, irritability, that goes back to the things that Jeff said, reaching for the vape, dropping everything, and vaping more before stressful situations. We did, from our data, show that it can take up to 30 months before people become daily vapors. And then it will be up to 16 months before people are waking up during the night to vape. But it's enough to notice that within 24 months, the people who vape nicotine e-cigarettes are becoming actually, showing a lot of signs of addiction, and just building a little bit more on some of the information that Jeff shared. We also found in our qualitative studies that not only are young people feeling these things when they are using e-cigarettes, but those who realize it and then want to stop are actually very angry that they have become addicted. And they're finding it quite difficult to stop vaping. Indeed, the Lung Health Foundation has its Quash program. We've also developed 3 apps now that are designed to help young people take steps to quit vaping. And what we're seeing in our evaluation, what we're seeing in our evaluations is that actually this is a very challenging situation. I want to move on now to look at some of the other disease outcomes. So it's really important to note that we do not have sufficient evidence about the effects of vaping e-cigarettes on the main health outcomes that we're worried about: COPD, asthma, cardiovascular diseases, and cancers. But, and if this would only appear on the slide a little more quickly, I'd be happy. Oh, it didn't appear on the slide, but I can just tell you what the rest of the slide said. We do have information about the biomarkers and some of the symptoms that indicate that in the long run, people who vape are very likely to develop some of these long-term outcomes. And I'm going to start by showing you some of the information about these things from our studies from our cohort on respiratory symptoms. And this is found also in our systematic review. There is now very solid evidence that people who vape e-cigarettes have more respiratory symptoms than people who do not vape e-cigarettes. And this figure demonstrates to you that the more puffs of e-cigarettes that a person has per month, the more respiratory symptoms they have. And so if you are smoking 800 puffs or more, you are going to have more than 2 respiratory symptoms. So that's one study that we did. And the next study, we looked what happens over time. And we found that longitudinally, the longer that you vape, the more respiratory symptoms you are going to develop. What are these respiratory symptoms? These are also validated scales. And we're looking at cough, phlegm, wheeze, difficulty breathing. Yeah, those are the main respiratory symptoms that we're looking at. And so there's no question that people who vape are having more respiratory symptoms than do others. Now, does that prove that they're going to develop asthma or COPD? Not 100%, but if it were me, why would anybody want to have these respiratory symptoms? Yeah, this just shows the significant increase in respiratory symptoms that people are facing. Yeah, so this slide is just a summary of our systematic review on the health effects, showing that there are increased respiratory symptoms, and the biomarkers show that there is airway damage, inflammation, and hyperresponsiveness. For cardiovascular, there's certainly increased heart rate and blood pressure for vapors. And for cancer, we really don't have any lung cancers identified so far. So I want to move from there to talking a little bit about the e-cigarette policies. What do we have in place? What do we know about their effectiveness? And what more can we do? So the policies that we may want to look at, and there can be more, are things about age restrictions, marketing restrictions, nicotine concentration restrictions, flavors, and taxation. And just to remember that it's really difficult to provide any solid data on the effects of the policies that we have in effect right now. Just not enough time has passed. There was COVID happened to us in the middle, making it difficult to tease out COVID effects from other effects, and we don't really have great data. I want to start talking about some of these policies by telling you from a DCE, that's a discrete choice experiment study that we conducted a couple of years ago, which is a very scientific way of asking youth and young adults what would they do in different scenarios. So we were trying to find out, well, what actually attracts youth to vaping? And we found that youth are much more likely to vape if they have medium and high nicotine concentrations available, as opposed to no nicotine or very low nicotine. They are much more likely to vape if they have flavors available to them, aside from tobacco and menthol. They are much more likely to vape if it's affordable, so the price is low, and they're much more likely to vape if e-cigarettes are easily available to them. And so, if these are the reasons why, and these match up, I think, quite well, Jeff, with the reasons that you gave. If those are the things that are attracting young people to using e-cigarettes, then here are some of the things that you could do if your goal is to decrease youth use of cigarettes. Restrict flavors to tobacco only. Get nicotine concentrations down to low or more. Make e-cigarettes only available to people who smoke, and perhaps by prescription, and increase the price up to some $40. So, these, from a scientific perspective, if policy were determined only on the basis of evidence, then pretty clear, this is what we need to do, and we need to do it very quickly. Regarding flavors, some provinces in Canada have actually prohibited flavors. Some have restricted them, like in Ontario, to specialty vape shops, and some have not restricted flavors at all. And what do we know? What does the literature tell us about the effects of e-cigarette flavor bans? And also from our own research, we asked our people in our panel what they would do if e-cigarette flavors were banned. Well, a good proportion, a substantial proportion, would actually quit using e-cigarettes. Those who were not yet using e-cigarettes would be much less inclined to start vaping. We don't know sufficiently what proportion of adults who are smokers, or young people who are smokers of combustible cigarettes, which switch completely to tobacco smoking. What we do know is that if flavors were banned, a lot of young people who use them would try to switch to tobacco or menthol flavors. There is also some evidence that people would go to the illicit market, and indeed another study that we've conducted demonstrates that we have a budding illicit market in e-cigarettes, driven at least partially by flavor bans in some of the provinces. This map just shows us where e-cigarette flavors have been completely banned, the red, in Canada, where they're restricted to specialty vape shops, Ontario and British Columbia, and where there's no restrictions at all. And we also see the results of a recent systematic review about the policy effects of banning e-cigarettes. That's an international systematic review that demonstrates the majority of vapers either find ways to continue using banned flavors or switch to tobacco or menthol flavors. So flavor bans are not going to be in of themselves, they're not going to actually do it. What about doing more on nicotine concentrations, a question that Jeff posed? From the scientific evidence that I've seen and from the effects that we see in our studies, our current restriction to 20 milligrams per milliliter, also known as 2%, is nowhere near sufficient. I mean, this is plenty of nicotine. And as Jeff indicated also, people can puff more and they can puff harder. It's plenty to get addicted and to remain addicted. So, that in of itself is also not going to solve the problem. And, here we just see the progression over time in what's happened. We have to remember the move from free-based to salt-based nicotine is also something that has increased the addictability of nicotine. So this decrease in nicotine concentration is unlikely to have any significant impact on initiation or the development of dependence on e-cigarettes, unfortunately. So what else can we do on the policy front? Well, marketing restrictions, have been a big thing for combustible cigarettes. Unfortunately, we came out of the gate when we legalized nicotine e-cigarettes with a huge amount of marketing, which led to a lot of uptake. In 2020, restrictions were introduced, but perhaps too late. We also know from studies that we've done, and anybody can go online, try to put in a few words related to interest in vaping and see how much advertising you get. Young people are exposed to a great deal of online marketing for e-cigarettes, and as we know, a lot of young people live a good part of their lives online. So I think the final policy, well, there's taxation, which the federal government introduced as of October 2022. Some provinces indicated here have matched that taxation rate. We don't yet know much about the impact of these taxes on the uptake of initiation of e-cigarette use by young people or on their cessation. But I'm kind of skeptical that this is going to do it. And I'm also worried that our illicit e-cigarette market is growing too much. So, what can we do? Well, what about age restrictions? Well, what about age restrictions? We have age restrictions. All these young people that I showed on the very first slide in high school from grade 7 to 12 should not have access to e-cigarettes, but they have access to e-cigarettes. And 45% of them say they get it directly from retail stores, just by going in and those stores not abiding by those restrictions that we have in place. Not only that, but they're getting a huge amount from online vendors. There is an outstanding question for Ontario and British Columbia, of whether restricting high nicotine and flavors to adult-only stores decreases underage access. Our current cohort study, and we don't know for sure. There are some suggestions that this may be having some effect, but we can do a lot more regarding age. And that's why our next speaker is all set up to talk about smoke-free generation. And I think this is a really good segue to pass the baton on so that we can talk about, there is also raising the age to age 21, which has demonstrated as being very effective, but smoke-free generation is a bold new move. So let's hear about that. Thank you.
Rob, it's perfect. It's working perfectly, Howard. And I have to say, the chat too is following along. There's lots of really good questions in there, people answering those questions, and then Rob, you answering them as we go. So we're taking stock of what's there. Chris, let me hand it over to you to kind of really set the tone and get people. There's a lot of inspired people in this chat that want to be able to do more. So over to you.
I can see that. The chat has been fantastic. And I see all of it sort of culminating into, well, what can we do? What is there to be done? And I can't say enough about the presentations that Jeff and Rob have given. They've highlighted a lot of the different things that could be done. And I want to make this very clear. A smoke-free generation policy is not the silver bullet. It's going to take several measures. And in fact, I saw it go by in the chat. We're shooting for the moon a little bit. We understand that a smoke-free generation is going to take a lot, but it is time for us to be bold if we are going to be able to make a true impact on what this looks like. I am going to give you a hopefully about a 25-minute presentation on what that might look like here in Canada. A couple caveats to this is one, some of this is from a British Columbia perspective. Our hope as the BC Lung Foundation is that we on the very far left coast and our leftist ways, hopefully there's a way there for us to float this boat a little bit sooner. And we have had quite a bit of traction with our Minister of Health. So we're hopeful that there's something there as well. And the other caveat to this is I want to really thank Lauren D'Souza from the BC Lung Foundation office. She has spent countless time with me. We spoke to just about every jurisdiction in the world that has attempted some version of this. And that is the basis of how we think something like this might work here. So when we talk about a smoke-free generation, there's a couple things that I want to throw out there too. I'd like to take credit for this and say I made up this idea, but the truth is I think all of us know that I didn't. We know that the UK is looking at it. New Zealand took a good hard stab at this as well. Jurisdictions all over the world have. We call Dr. John Barrick the godfather of the idea of a smoke-free generation. Now, Dr. John Barrick, he was a professor at a university, and it really alerted to him that there was all this tobacco dollars that was actually funding grants and bursaries and scholarships at his university. So he raised the question, well, this doesn't seem right. How could we be funding the education of our kids on the backs of tobacco dollars? So his dean said, well, crunch the numbers for me. You tell me what you think. It's the money. We want the money. The truth of the matter is he crunched very simple numbers because John Barrick is not a medical doctor. He is, in fact, not a health professional. He has his doctorate in mathematics, and he did what any mathematics professor would do. He looked at what it would save the world in terms of health dollars and the economy. And the number one thing he came up with was the easiest way to save the economy of the entire world is to stop people from smoking in the first place. And here we are. We were born with the smoke-free generation idea, and I'm going to try to advance my slides. All right. So because I'm very hip and I'm very cool, I'm going to start my presentation with a TikTok video.
So Cassandra, my pre-K student who's addicted to pretend vaping. Kids are at dramatic play. They're playing house. I see Cassandra grab the marker and she's like, and I was like, Cassandra, we're not using the markers as cigarettes. And she's like, it's not a cigarette, mister, it's a vape. Well, we're not using it as a vape either. She's like, mister, you don't know. I have a lot of stress. And I was like, well, what's stressing you out? She's like, well, at recess, Derek gave me a hug. And then right now, Gavin gave me a hug. And I was like, okay, so what's stressful about that? And she's like, I'm pregnant now, and I don't know if Derek is the dad or if Gavin is the dad now. Absolutely not. She's like, well, I want Derek to be the dad because if Gavin's the dad, all he's going to do is hang out with his boys. Absolutely. I mean, Derek would probably definitely be the better choice of the two because, Gavin, he'll probably, absolutely not. Miss Martinez, hey, you ready to clean up? Clean up, clean up, everybody, everywhere.
So that video, why that's there is I really want that to highlight one really key factor. And that one key factor is Cassandra, 5-year-old in kindergarten. Cassandra, she is trying to cope with her stress, whether we think that stress is real or not. She's using a vape pen. That is a learned behavior, full stop. She has seen her parent, somebody else do that. And I want you to keep little Cassandra, 5-year-old Cassandra, in mind as I go through the rest of this presentation. Now, the big thing that we obviously want to get across when we talk about a smoke-free generation is this one key fact. There is no safe age to vape or smoke. Now, we can talk about age limits, and age limits actually do make a significant impact, and they could be the right stepping stones to the right solution here. But I want to make that very, very clear that there is no safe age to vape or smoke. If you turn 19 in British Columbia, it's not suddenly safe. You turn 18 in Alberta, it's not safe for a year earlier, or if it's 21 in Quebec. So let's make it very clear that there's a problem that we're sending about what a safe age actually is. Now, what does the safe age actually mean? So I try to move my slides again here. Here we go. So in British Columbia, there are 6,000 deaths caused by tobacco each year. Now, I also want to make this point very clear as we go through the presentation that we are looking at tobacco and vapor control sort of in the same lens, even though we are going to see that's not very accurate in the way we do it. That really means here that in British Columbia that there were 67,000 potential lost years of life. Now, I also don't need to tell people in the group here that 67,000 potential lost years is a lot of life that we've lost that could have been lived, a lot of potential there, a lot of great things that could have happened. And as we return to that dollar amount idea, that means in British Columbia, that's $2.2 billion that are spent annually on healthcare costs. And while we know that we don't want to make tobacco and vaping all about the dollars, it is part of the conversation if we're going to make significant impact when we talk to politicians at a policy level. So I think it's time for us to really sort of understand that traditional tobacco control is not working. Now, I say that with a little bit of a caveat because it's not entirely a true statement. And I'm going to show you this graph later on that we are doing quite well as a country in terms of bringing that number down. We've done significant work in tobacco control about smoking prevalence. In fact, across the world, we have some of the best numbers in British Columbia in particular. But what I think is really important is that the status quo is not going to be good enough for us, and that we really have to make some significant measures. Now, the reason why part of that is the case here is that smoking rates are simply too high in disadvantaged populations, and they become a little niche for us. It becomes hard for us to come up with that one thing that really works. So you can sort of see that here in our LGBTQ youth population, they're 2 times more likely to start vaping. It's 2 times higher in our Indigenous communities. And of course, The big one is the youth that we have in our country that are living with mental illness, they're actually 5 times more likely to start vaping. And those are numbers that are pretty big. So it requires us to be fairly significant and fairly bold with how we're going to reach out and do this. Now, one of the most alarming stats we've come across is this one that's on the slide here. 9 out of 10 people who smoke start before the age of 20. Now, wouldn't it be really nice if we could simply stop that from happening? If we could move that number and keep it out of the hands of our kids. That becomes the significant part of what we're going to try to do. Here in Canada, there is an end game goal of 5% by 2035. The truth of the matter is, at the rate we're currently going, that simply cannot be met. So here we are. We're going to talk about the smoke-free generation policy. And for those of you who aren't entirely familiar with what we're talking about with the smoke-free generation, the concept is this, that the minimum age that anybody can legally purchase vapor or tobacco product goes up 1 year every single year. So for example, in British Columbia, the minimum age right now is 19. If this were to go into effect this year in 2025, the minimum age would then go to 20. And then in 2026, it would go to 21. And then in 27, it would go to 22. And it would keep going on and on and on until an entire generation of Cassandras no longer would have the ability to legally purchase vapor or tobacco product. Now, there's a looming question with that, of course, is they seem to still be getting it. So there are several measures in place that we have to take a look at and several case studies from around the world that we should also take a look at. So in the interest of time, you can see on this slide, there are 5 factors to a smoke-free generation. Of course, we know that's not entirely true. There's probably about 1,000 factors to making this really work in Canada, but I'm going to go through 5 that we think are going to be quite significant to how we do this. Now, I can't thank Jeff and Rob enough. They really highlighted this idea that we have a generation of people that are dependent on nicotine. So we have to start moving that needle because we know that big tobacco, and it was mentioned earlier as well, owns the largest stakes in our vapor products. And it's because they know that their business model exists here. And that's what we need to start changing and need to try to get ahead of. The other thing, of course, is closing gaps in legislation. I highlighted earlier around what the different ages are. That creates significant gaps in the understanding of when is it safe to do that. And like I said earlier, there is no safe age to vape or smoke. So simply, if we were to able to introduce a smoke-free generation policy here in Canada, it makes it very clear that no matter where you live, whether you live in Vancouver or Halifax, that there is no safe age, and turning of age doesn't make it okay. So I'm going to return to the healthcare spending. This is, of course, British Columbia again. I apologize, the slide's a little bit hard to read here. But in British Columbia, the taxation piece often comes up. And this is what it costs British Columbians. So the annual cost per smoker, you guys can see those numbers there, about $3,300. You get about $1,600 of annual tax revenue. Right there, right off the get-go, we're in the whole $1,700 a smoker. I suspect those numbers are going to be somewhat similar depending on that taxation, of course, from coast to coast. But you are looking at significant savings immediately. A big one, of course, is the retail disruption. We had to go through a discussion earlier, of course, around what a specialty vape shop is and who's allowed to sell it and why do they have access. And we also know that big tobacco, having spoken to our international colleagues who have attempted this, they fund the retail lobbyists around suggesting that there's a significant loss of income that happens, and they are going to be small businesses that are going to be put out of house and home because of this. Now, we know that this isn't true because numbers from the retail industry themselves at those stores, aside from the specialty vape stores, so we're talking about the gas stations, the corner stores, the places like that, vapor and tobacco product make up less than 2% of their revenue. Now, I work at a nonprofit. A bunch of us do, and we work on small budgets. I'm not laughing at 2%. 2% is significant to anybody, but I also want to make it very clear that this is a phased-in approach. So let's not forget that in a smoke-free generation policy, people who are legally able to currently purchase vapor or tobacco product will continue to be able to do so. It simply prohibits our minors from being able to do so, and it keeps moving that needle forward. So there's sort of a phased-in approach there as well. The one last point that I want to bring up in these 5 points, of course, has to do with the cessation portion. We have to respect the fact that addiction plays a big role in how we want to handle this. We have to be sensitive to how we handle their process moving forward. Here in Canada, I often call this slide the capital F word, or the F word in Canada, freedom. This is the part where people question, well, you're impinging on my freedom to do what I want, and for me to smoke, and for me to vape. And that's not true. The truth of the matter is, like I had mentioned earlier, if you are legally able to do so now, you will continue to be able to do so. And we want to actually increase cessation support for those people that are trying to quit. So there are several resources out there. I know a lot of them have been mentioned. The Quash app is a fantastic one. If you live in British Columbia, there's a Quit Now portal. In fact, there's a youth portal that just got released that was created by youth for youth and guides them through a quit journey in British Columbia. You can see on this slide as well, 90% of people who smoke regret ever starting in the first place. 9 out of 10 wish they didn't start. 9 out of 10 wish their kids would never start. Makes me question who the 1 in 10 is. And almost more alarming too is 4 out of those 10 smokers support an outright ban of tobacco and vapor product right now. Now, those are the people who use the product. So in there's an alarming amount of support for something like this. And that is something that we should really take a look at. Now, on this slide, I'm going to show you a really terrible graph. And it's probably going to drive Jeff and Rob a little bit mad with the statistics. But I intentionally removed some of the numbers. So what you want to see here is you see that bar that's come across there. The numbers are taken off here because they're a little bit different in every jurisdiction in the world. But one thing that's common here in Canada is that this line shows you the current smoking prevalence. So for example, in British Columbia, over the last 6 years, we've gone from about 12% as a smoking prevalence all the way down to about 8.5%, 9%, 9.5%, depending on what reports you look at. So we are making progress. That arrow is pointing down. Now, if we were to implement a smoke-free generation policy, we obviously want to know what those numbers would look like. In New Zealand, in their previous year, in their previous administration, when they really took a look at doing this, they used modeling data from one of our greatest examples in the Philippines, and were able to propose this. And this is what it looks like if it were to be implemented here in Canada. Now we're getting a heck of a lot closer to what that 5 by 2035 looks like. It shows you that there is significant progress that could be made that's above and beyond what we're currently doing. So again, moving away from the status quo and moving into something bold. Now, with my time that I've got left, I'm going to highlight 3 jurisdictions that have gone through some process of this. And the first one that I do want to mention is New Zealand. Now, a little bit unfortunate with New Zealand because their previous administration put quite a bit of work into making a smoke-free generation part of their future and part of their reality, only to have it repealed recently under the auspices of needing taxation dollars in the new administration. But what I do want to highlight is this. They never fully were able to implement this because only a year had passed. But in that 1 year, they demonstrated some significant numbers around education of the youth and the people around smoking and vaping. Now, the one thing I want to make very clear with New Zealand too is they did not include vaping as part of their smoke-free generation proposal. It was solely centered around tobacco. Now, in that 1 year, that little graph I showed you with the line, the previous slide, their number went from 9.6% smoking prevalence down to 8%. So that's a bit of a bump down in terms of what that looks like. Now, like I just mentioned, they did not include vapor as part of their smoke-free generation policy. Their vaping numbers went from 6.8% in that 1 year up to 8.3%. Now, if you're paying attention, and I know you all are, that number tells you that they now have a higher prevalence of people vaping in their country than they do have tobacco users. Now, that's something important for us to know, because that problem, while seemingly separate, is part of a larger issue that we have to discuss. Now, one other place that I want to bring up is Brookline, Massachusetts. And I know a lot of you are thinking, well, where in the world is Brookline, Massachusetts, other than in Massachusetts? Brookline is a small, affluent community. They have a very low smoking rate. I believe their rates, when they implemented a smoke-free generation policy, was less than 4%. Now, the reason why they went through and did this was because this effort was actually led by a lawyer. She felt that it was important for her city to implement a full-scale smoke-free generation policy because they could enforce it. It was going to have public support, and they were willing to take on big tobacco in a legal fight. Well, guess what? We find out a month ago that Brookline has won their legal battle against big tobacco. Now, that is significant for us in British Columbia. When we spoke with the authorities in Brookline, their primary goal was actually that this would set precedents for other jurisdictions in North America to perhaps take this on. What's happened is across Massachusetts, there are several counties that are now implementing, on the heels of their success and their victory over big tobacco, implementing full-scale smoke-free generations within their county limits. So there's a significant win and a case study for us to use here in Canada. Now, the biggest one that I want to point to, of course, is Bolonga City. Bolonga City, those of you who may or may not be familiar, is a large city in Asia. Asian countries, anecdotally, obviously, with large smoking contingencies and a smoking prevalence. They were able to implement in 2011 a full-scale, within their city limits, a smoke-free generation policy. And this is also part of our case study for what we could do here in Canada, because it wasn't just a policy. It came coupled with very extreme measures around education, access, what stores it could or couldn't be in. They went on a full-on assault on tobacco and vapor product in 2011. They did, unfortunately, lose to big tobacco in 2017. Now, while that is bad news, it does give us roughly 6.5 years of data for us to work with. Now, the smoking prevalence in Bolonga City with adults in 2011, when this was implemented, was right around 24%. So 1/4 of their adult population identified as a smoker. By 2017, that number had dropped all the way to 14.8%. That's a remarkable number. That's nearing the numbers that we see as a Canadian average here. But where it's even more astounding is the smoking prevalence with youth. That number was right around 32%. So 1/3 of their youth identified as being a vapor or a smoker in 2011. And all the way down to 2017, they moved that needle to 1.6%. That is proof positive that something like this could work. There are all sorts of anecdotal numbers around types of behaviors and percentages of people who like to do certain things. We also know somewhat anecdotally that 2% of any given population in any given activity is prone and likes to take risk. They like to be the rebellious ones. That's 2% of the population. Well, here's that number here. It's reflected here. 1.6% of the population of their youth we're still doing it, but that is a far cry from 1/3 of their population. Proof positive that something like that could have a significant impact. Now, a lot of what I've talked about sounds pie in the sky, a little hyperbole, but the truth of the matter is if something like this moonshot were to happen here in Canada, it would be the most significant public health victory of the 21st century. And that is not a hyperbole. In fact, if something like this were to happen, how nice would it be for us to be able to say, do you remember smoking and vaping? That was a last century phenomenon. That is not actually unheard of. That's happened throughout the time of history. And that we could be on the track of doing that. Now, I mentioned early on, there is no silver bullet. This isn't the silver bullet. There are several steps along the way. whether that's with flavor bans, moving that age to a more consistent across the country 21, removing access. All of these things could be steps towards a smoke-free generation. But I want to make it very clear that those things are actually very possible in its entirety here in Canada. And I'll leave this with you in closing. I talked about Cassandra at the beginning, 5-year-old Cassandra. And I think it's important for us to think about her. You didn't get to see her face, probably for privacy reasons. You get to see this little guy, because this is my son. His name is Quinn, and he is also 5 years old. So if you won't do it for Cassandra, please do it for myself. Very selfishly, a smoke-free generation would impact children like Quinn, and it's important that they don't have access to vapor or tobacco products as they grow older. And that's it.
Thank you, Chris. As always, again, conversations continued in the chat. So curious as to how what people's reaction to what Chris has put forward. I'm going to hand things over to the Lung Health Foundation CEO, Jessica Buckley, to provide her reflections on the conversation to date and bring forward a way in which everyone can get involved in a real way today. So over to you, Jessica.
Thank you very much, Jess, and good afternoon, everyone. Every time I hear Chris Lamb speak, I learn something new every time, and he's just so passionate on this concept of a smoke-free generation, and has brought so much great information forward today. So thank you, Chris, for that passionate presentation. Also, every time I hear Rob or Jeff speak, it's the same thing. They're just such interesting stories. And, hearing from Jeff that the number one reason for school suspensions is vaping, and knowing friends that teach in different communities, and just the concerns that vapes have brought to not just high schools, but elementary schools. And I know there are people that have joined us today that are experiencing all of those challenges. And when Rob talked about the addiction rates, knowing that our kids are addicted to anything is just so upsetting and so wrong. And, being with the Lung Health Foundation, the incidence of lung disease in Canadians being 1 in 5 Canadians suffering, to think that those kids are likely to be suffering future harmful effects of lung disease, and Rob talking about the biomarkers that are found in people that are vaping. We know the issue is real. The people that have joined this call today are passionate about doing something together, and I'm so glad that you've joined us today so that you can learn more and learn how you can help. So the Lung Health Foundation has been at this a very long time. We are a very old charity. We are a national charity today, but we were formerly the Ontario Lung Association. So for over the last 40 years, we have been working along with others to help implement policies around Smoke-Free Ontario and tobacco control policies and reduce smoking rates. And it's so hard to believe that, here we are again, now trying to help keep kids safe and away from the harmful effects of vaping. So I think by showing up here today, you've already shown a commitment to wanting to help. And I guess the big question is, how can we move forward? And this concept of the bold ask of a smoke-free generation. There are lots of great ideas that I've seen pop up in the chat today from people on the call, as well as, ideas for policy change that have been presented by Jeff, Chris, and Rob. So we are going to be forming those asks in the coming weeks and months, and we would like to have you join us in this movement. So we're asking you to take a pledge, and there's a link that you would have received by email. We will be sending it out again after the policy forum, and you'll have the link. And you can take the pledge to join us in the movement of a smoke-free generation. So this is not a petition at this point, but it is a way for us to be able to stay in touch with you, keep you informed on how these policy asks are coming together, and how you can add your voice to the conversation. So we encourage you to sign the pledge, share this with family and friends, and we will keep you posted. I'm not going to keep going on because I know there were some questions that came up in the chat, and Jess, I'm going to pass it back to you so we can get to a few of those. Thank you
Thanks so
again
much.
for being here, everyone.
Thank you, Jessica. We'll put the link in the chat as well, and the email is right in your inbox now, and so you'll have the link to take that pledge. To Jessica's point, we will be following up with everyone that registered. There have been some questions as to whether or not this has been recorded. It has. We will be providing a link back to you once that's up and running, recognizing that you might want to share it among your colleagues, among your family, friends, etc. And we'll stay in touch with you as the Lung Health Foundation continues to build this movement. So we do have, it's funny, like people are answering other people's questions, which is always such a good thing to see. I think there was a lot of what resonated a lot, Chris in particular was, and Rob, I don't know if you want to speak to this, but what Canada is trying to achieve by 2035 and how we're just not on track for that. I'm wondering from some of the sort of the Ontario budget just was released, the federal budget was just released. Do any of our speakers have any sort of insights or comments as to whether or not we're moving in the right direction or whether or not some of those policies, particularly in Ontario, some of the policies were more around restrictions, ensuring that we can stop some of the illegal sales, et cetera. Where do you think we are right now? And what does the past sort of federal budget and provincial budget sort of say to you guys as you think through that? Rob, are you okay if I start with you on that
I can start it off. No,
Yeah.
we're not getting there. We're moving in the direction of decreasing the rates of use of combustible tobacco. But if we were to include e-cigarette use in the prevalence, then we're moving in the wrong direction because the use of nicotine by young people is much higher now than it was 5 years ago. If you add the nicotine use from e-cigarettes to the nicotine use from combustible cigarettes. But even if we just talk about combustible cigarettes, we're not going to make it to less than 5. It's got to be less than 5 by 2035. With what we have, we need bold measures like a smoke-free generation, like denicotizing cigarettes. We need to work on the supply. We've got to decrease substantially the availability by decreasing retail outlets. We've got to increase the price. I mean, for goodness sake, in places like Ontario, cigarettes are dirt cheap.
Yeah, thank you. Jeff, I saw you come off mute. Do you want to join in there?
Yeah, so in the fall, the excise tax on vapor products and e-juice were increased, and I think the federal budget just stated that there was another federal, excise tax increase. And it really, it's like a buck a product type of thing. So it's not that prohibited, that much of an issue. But for young audiences, I think there is some research. Every dollar you raise, you remove certain people from the price point. So I think is helps, but it's we're picking away at the margins and we're not taking on the big issue. That takes more and more people working in that area, unfortunately.
Absolutely. Chris.
Yeah, I think Jeff actually nailed it right there, picking at the edges. That's what it sort of feels like. I mean, we know that all our governments, provincially and federally, they're interested in the topic. They want to do the right thing, and I think there's a bit of paralysis in terms of what that is, and that's why leaning on some other jurisdictions does sort of ease that burden on us a little bit. I think the big challenge for us, not just in Canada, but implementing something like this, is that we want to take a big stab at changing that language and that understanding around what tobacco, nicotine, vapor product does to us. And that comes with that full scale change, kind of like they did in Belonga City. It has to come with all those things. And that's why I don't want to discount things like and say that if we do a smoke-free generation, it's not important for us to move to age 21 because it still is. It is important for us to understand that these things are not good for us, and the final thing I'll leave you with is we need something like a smoke-free generation to sort of be that big swipe, that big bold thing, because we know, and I know Jeff has seen this firsthand, the technology and the amount of resources that big tobacco puts into their products, it's so far outweighs how we can even keep up. Like I remember in 2019 when vaping became a thing that all our lung organizations really started to get behind as something we should care about. there were so many things already ahead of us. It was such a learning curve for us, and so we have to have something that sort of encompasses things at a much larger scale so that we can at least gain some of that ground that we lose when we don't have the type of resources that they do.
Yeah. And there's lots of conversation too, and we're learning this as well around how to access the youth. It's a different audience for a lot of us that are working in the health system or working in health promotion. And so it also has to sort of leverage not necessarily innovative solutions, but we have to think differently. The health system is not always the greatest at thinking about their audiences in a different way, and meet them where they are when they're not part of the health system. And that's where those partnerships, I think, with public health units and organizations like those that are part of the National Lung Health Alliance, that we exist as a not-for-profit because we're out there supporting families and people where they are. And so there's an important role, I think, for all of us in terms of having that common messaging and moving something like this forward. We are at time, but I do just want to again thank our panelists. You guys really dove into this and worked hard to get these messages across. This will not be the last time we're having a conversation like this. We are very committed on all of the panelists as well as the organizations we've spoken about. So stay tuned for more. We will keep going. We're not letting this one go. It's a marathon, not a sprint, but we will get there together. I'm confident of that. So enjoy the rest of your day, everyone. Thank you so much.